Hello everyone. Our session today is on sexual and reproductive health among refugees. In this session, we will try to understand the scope and epidemiology of sexual and reproductive health in a humanitarian crisis and to explore challenges and barriers to apply effective interventions and programs re sexual and reproductive health in refugee population. Why is sexual and reproductive health is important? The right to sexual and reproductive health is an indispensable part of the right to health and is dependent upon a number of factors that include availability and accessibility to quality evidence-based service. Sexual and reproductive health implies that people are able to have a satisfying and safe sex life and have the capability to produce and the freedom to decide if, when, and how often to do so. But why are women in conflicts at a high risk? Access to quality sexual and reproductive health services plays a vital role in the well-being of a human being and is particularly relevant for people living in a situation of forced displacement. Refugees and other displaced people who have access to sexual and reproductive health services are better supported on their way to a healthier future and can benefit from the positive impact these services have on the family and the community at large. It's important that services respect the various religious and cultural backgrounds and that the quality of care as well as the range of services conform to universally recognized human rights standards. Women face discrimination and violence simply because of their gender. Vulnerability to disasters is a social dynamic rooted in the interaction between gender and class, cultural, nationality, age, and other power relations. There are several known health risks that women and girls face in conflict and displacement settings. First, armed conflict disrupts access to essential services and distribution of health care, which includes the provision of women's health care. Prolonged emergencies weaken health systems, with long-lasting effect on women's health care. Second, aspects of women's health that suffer in conflict and displacement include access to family planning, safe motherhood, sexual and gender-based violence, and disproportionate risk for sexually transmitted diseases, including HIV. Displaced women are at daily risk of safety and security, as well as sexual, physical, and mental abuses as they attempt to survive. There are many challenging topics related to reproductive health. First of them is abortion. The topic of abortion remains highly relevant in any context, but more so in humanitarian settings, where access to safe abortion and post-abortion care is ever more pressing. In crisis settings, comprehensive abortion care, both safe abortion and post-abortion care, needs to be prioritized to address the high maternal mortality and morbidity from complications of unsafe abortion. The second challenging topic is the gender-based violence. Sexual violence as a form of gender-based violence has occurred through history and has long been associated with war and well documented in recent humanitarian settings. Sexual violence survivors experience negative physical, psychological, and social outcomes that may last a lifetime. The problem is even more pronounced in refugee populations, where women and girls are at increased risk of gender-based violence. Several factors have been cited as causing increased risk of GBV, including extreme poverty, minority status, lack of access to food and water, and disrupted family and community support system, among others. The third challenging topic is maternal and newborn health. Countries in a humanitarian crisis represent 61% of total number of maternal deaths worldwide. During the last 2 decades, maternal and newborn health has been relative progress in its integration into primary health services in humanitarian emergencies. Providing quality maternal and newborn care is still challenging due to lack of qualified staff, training, and support supervision. The minimum initial service package, or what we called it MISP, for SRH is a set of life-saving priority activities to be implemented from the onset of a crisis. The objectives of the MISP are to facilitate the coordination of reproductive health services, prevent and manage the consequences of sexual violence, reduce HIV transmission, minimize maternal and neonatal morbidity and mortality, and plan for comprehensive RH services in the post-crisis phase. Here are some recommendations to improve practice of sexual reproductive health among refugees women. First, to eliminate barriers to access to reproductive health care, including cost, overloaded public or private hospital systems, strained medical workforces, a lack of medical professionals, and female physicians. Second is the social barrier that includes stigma, fear of mistreatment or discrimination, lack of awareness, fear of reporting violence, and difficulties obtaining legal status. Refugee young women should be equipped with knowledge, skills, and approaches to deal with their current situation, including areas related to gender-based violence. The third recommendation to improve practice of RH is improving health system. In healthcare delivery, resource limitations, personnel shortages, and care coordination are the biggest gaps. Limited stock of reproductive health supplies has also been reported. Organizations have had difficulty finding reproductive health trained staff to deliver services. Fourth is the available data to drive solutions. It's imperative that the international community adopt a more scientific approach to monitoring and evaluating the MISP. Lastly, the funding and multilateral coordination. One strategic priority must be to substantially increase the level of support available to host states, thereby mitigating the socio-economic and political pressures generated by the refugee influx. Here are some guidelines to prevent and respond to sexual reproductive health in humanitarian settings. 1. Transforming socio-cultural norms with an emphasis on empowering women and girls. 2. Rebuilding family and community structures and support systems. 3. Creating conditions to improve accountability system. 4th, designing effective services and facilities. Lastly, working with formal and traditional legal system assessment, monitoring, and documentation of gender-based violence. Even though programs are addressing some of the delicate topics, more robust research is not only needed, but urgently required to build evidence on how to offer critical, life-saving sexual and reproductive health services in these unique settings. Most importantly, humanitarian practitioners, academics, and donors need to find ways of identifying policy and legal barriers that undermine the sexual and reproductive rights of these populations, and collectively strive to remove obstacles blocking the realization of these fundamental human rights. If women's reproductive health needs are not met, women are limited in their ability to contribute to social, economic, and political life.